Let's bring in Fox News medical analyst Dr. Marc Seigel. Good evening, Doc. What do you think about this? The president, obviously, for his age, is in a vulnerable group, but the White House is saying they're doing everything correctly, and the physician saying that as well.
Right. Good evening, Brett. First of all, he has two high-risk symptoms. One is his age, 79. The other is he has heart disease, atrial fibrillation, and arrhythmia, a rhythm problem, and that puts him in a high-risk group. The fact that he has mild symptoms doesn't mean that he couldn't worsen. On the plus side, the Omicron variants and the subvariants are overall milder. They don't infect deep in the lungs the way that the original COVID did, SARS-CoV-2 did. The other issue is that he's had vaccinations and boosters. So he's had 4 shots, and now he's on Paxlovid, which in my experience, treating many patients with it, I think it works very, very well in a vast majority of cases. There's been a lot of talk today about Paxlovid rebound. That only occurs about 10% of the time, and then you can actually give a second dose package of it. I find that works. 2 questions that weren't really addressed well today were, what about monoclonal antibodies? He's not being given that, and there's one in particular that works against this subvariant. And the other question that wasn't addressed is the issue of spread, and Jackie Heinrich just brought that up. They're saying that when he is no longer testing positive, he'll be able to go out in public. But of course, there was a photographer 6 feet away from him today wearing a mask, an N95, but he wasn't wearing one. So I think, and there's also the issue of close contacts, including his wife. We know at least 1/3 to 1/2 of people in the household where somebody tests positive for COVID will go on to get it themselves.
This antiviral Paxlovid, is it now being used all over the place? And what are the reactions to that? Do you stop being contagious after you take this?
You know, Ashish said he's in a high-risk group. I agree with that. It is being used all over the place. I confess that I'm using it even beyond the emergency use authorization. You know, I don't only give it to people that have pre-existing conditions or a lot older. It doesn't lead you to be less contagious for a while. In other words, it decreases the amount of virus you have, but until you test negative on tests, it doesn't mean that you're not contagious. And we've seen many cases where a person tests negative and then goes back to test positive again. You got to really monitor this very carefully before you let a person go out into public. And with the president, we again have to monitor symptoms here. I was surprised that he's continuing to work like this because he's suffering from fatigue. I'm concerned about long-term symptoms here. That also wasn't addressed. We don't know for sure. There's a lot of long COVID out there, and I'm not saying the president's going to get that, but I think he should be monitored for the fatigue, for the possibility of brain fog, for anything else like that, especially with his heart condition. We see issues with that as well. So they have to keep a very, very close eye on him.
Yeah, last thing, and Jackie played this in the piece, but take a listen. This is 1 year ago tonight at a CNN town hall.
Various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
Now, Doc, we now know that yes, you do. And in fact, there's 2 vaccinations, 2 boosters. This president has COVID tonight. We've evolved from the time that President Trump had COVID at the beginning to where we are now. But what we know about these vaccines is that it doesn't prevent it. It just prevents what? The severity of it?
That and Paxlovid prevent the severity and your risk of hospitalization. But it's really important that you're pointing this out because this was mismessaged all through the past year, and a lot of mandates resulted from it, and we lost an opportunity to give the real lesson here, which is it keeps you out of the hospital. It keeps you from dying. The death rate is very, very low right now from COVID, and that's really good news. We should have focused, the public officials should have focused on it that way. That's one kind of success of a vaccine. Yes, at the beginning, it decreased spread. At the very beginning, against the original strain, it decreased spread. It hasn't done that for a long time now, but it still keeps you from getting very, very sick. That message from the president a year ago did not help.
Yeah. Dr. Siegel, you help us always. Thank you.